A cough is a natural reflex that helps clear the throat and airways of mucus, irritants, or infections. A dry cough may sometimes be relieved by cough suppressants such as dextromethorphan, while a wet or chesty cough with mucus may benefit from expectorants or mucolytics, such as guaifenesin or ambroxol, which help loosen mucus. Throat lozenges and warm fluids may also soothe throat irritation. Always read the label carefully, follow the recommended dose, and avoid combining multiple cough and cold medicines with the same ingredients. OTC medicines provide symptom relief, but do not treat every underlying cause of cough. Seek medical attention if the cough lasts more than 2 to 3 weeks, or if it is associated with difficulty breathing, chest pain, coughing up blood, high fever, or worsening symptoms.